Today, we're pulling back the curtain on the hidden system that controls which medications you can get, and maybe more importantly, how much you end up paying for them.
So you've probably been there, right? You're at the pharmacy ready to pick up your medicine, and boom, there's a problem. It's been denied, or it's going to be delayed, or the price is just way higher than you expected. Well, the reason why is a lot more complicated than you'd think.
See, you might think your doctor writes a prescription, and that's the end of it. But that's just the first step. There's this huge, nearly invisible ecosystem working behind the scenes, and it's making critical decisions that directly hit your health and your bank account.
To really understand what's going on, we need to piece together this puzzle and look at who the main players are. Okay, so this whole setup is called managed markets. And at its core, you have these powerful gatekeepers. You've got your health insurers, government programs like Medicare, and then there are the pharmacy benefit managers. You'll hear them called PBMs. These are massive third-party companies whose entire job is to negotiate drug prices for millions and millions of people. So we know who these gatekeepers are, but how do they actually control which drugs you get? What's their most powerful tool? Well, it all comes down to something called a formulary. You can basically think of it as a tiered list of approved drugs. If your medicine is on a low tier, like tier 1, your copay is low. But if it gets pushed to a higher tier, especially these specialty tiers, your out-of-pocket costs can just explode. Sometimes you're on the hook for up to 50% of the drug's total price. And get this, the formulary is just the start. The gatekeepers can throw up all these other roadblocks. They might demand a prior authorization, where your doctor has to spend time getting special approval. Or they'll enforce step therapy, which forces you to try and fail on a cheaper drug first. Each one of these barriers means delays, or worse, you just don't get the medicine at all. So, with this incredibly complicated maze, how do drug companies even begin to navigate it? Well, they've turned to a really powerful tool, a kind of map built from the journeys of millions of anonymous patients.
This map is built using something called Anonymized Patient-Level Data, or APLD for short. It's pretty amazing, actually. It lets analysts follow the entire treatment journey for millions of patients over time. What they were prescribed, what they actually picked up, what happened next, all without ever knowing who the individual is. Now, this is what makes APLD a total game changer. See, the old way of looking at data was just seeing the big picture, like the total number of prescriptions sold in California. But APLD, it follows the individual story. It can see if a patient was denied a drug and then switched to another one. Or, crucially, if they just gave up and abandoned their prescription at the pharmacy counter.
And I know what you might be thinking. What about privacy? That's absolutely the most important thing here. This whole process is locked down tight by strict HIPAA rules. 18 specific identifiers, name, address, social security number, all of that are scrubbed from the data. It's a one-way street of anonymization, so there is no way to ever trace it back to a specific person.
Okay, so we've got this powerful anonymous data. How does it actually change things? Well, for the first time, it allows companies to see the real-world fallout from all those gatekeeper decisions.
It all comes down to connecting the dots. With APLD, analysts can finally see the direct consequences of those formulary tiers and access barriers we talked about. You're not just looking at rules on paper anymore. You're seeing how they actually affect human behavior. And sometimes, what it uncovers is pretty shocking. For instance, APLD is the only way we know that for those really expensive specialty drugs, up to half of all prescriptions are just left at the pharmacy, abandoned. Think about that. Patients are literally walking away from their medicine, and it's almost always because of those high out-of-pocket costs.
And check this out. This is a perfect illustration of what APLD can prove. You're looking at what happens when a gatekeeper makes a drug more expensive. On the left, you see prescription numbers before that change. On the right, you see what happened right after. That 18% drop isn't a guess. It's hard data showing that when costs go up, access goes down. Period.
This data also lets analysts play detective with something called source of business analysis. They can dig in and answer these really critical questions, like, are we losing patients because an insurer just restricted our drug? Or are new patients coming to us because a competitor's drug is now harder to get? APLD provides all the clues.
So let's zoom out for a second. When you put all this together, the gatekeepers, the negotiations, the data, what does it all really mean for us? You know, it really boils down to this. Making a breakthrough drug that can save lives, that's only half the battle. The other half is this huge, invisible war fought with data and dollars inside the managed market system, just to get that medicine into the hands of the people who actually need it.
And that leaves us with a really big question to think about. As this data gets even smarter and the ability to track and analyze our healthcare journeys becomes more and more powerful, who really wins in the end? Is it the system, which is focused on controlling costs, or is it the patient, who's just hoping to get access to the care they need?